Hello everyone, this is Dr. Shamama and today our topic of discussion would be infections of the central nervous system. So this is a very interesting topic and that's very fascinating for pathologists when we see infections and organisms under the microscope. So this is going to be a lot of fun, so let's start. This was my presentation during my rotation in neuropathology department at University of Washington. So these are gonna be the overview that what would be the points we will discuss in this video. Today our discussion topic would be Acanthameba, and what it causes, it's Granulomatous amebic encephalitis GAE. So these we would be discussing in detail now. Let's start with the scenario. So an old patient with history of immunosuppression presented with headache, fever, stiff neck, focal neurologic abnormalities and seizures. How it would look like characteristically, there would be granulomatous inflammation with multinucleated giant cells as suggested by the name granulomatous, and these are the multinucleated giant cells seen, and it is usually confused by granulomatous tuberculosis, so we have to differentiate the both. The previous image was taken from the ExpertPath, and now this is an image from the case that the amoebas, they are clearly seen here, these big organisms which are 15 to 40 micrometer in diameter. They have a vesicular nucleus and dense central nucleolus within the white matter of the brain, and at higher power you can appreciate that these are the organisms: central nucleolus, vesicular nucleus, surrounded with these inflammatory infiltrate, and they are these are the amoebas seen. Moving on, amoebas, they are seen along with patchy hemorrhage and chronic inflammatory infiltrate with edema within the white matter. So this is the white matter of the brain. These red cells are the focal hemorrhage, and blue are inflammatory cells, and these are the organisms, Acanthameba in between them. The higher power version of that image is that zoomed up, these are the red blood cells, the hemorrhage areas. This is the Acanthameba organism, and these are the blue purple cells, they are inflammatory cells. So this is how it presents. Moving on, it can be seen in perivascular inflammation that this is a vessel in the perivascular space. We do see organisms along with some inflammatory cells. This is the higher power version of it. This is the organism seen with these scattered inflammatory cells and some focal hemorrhage. Now, some of the Acanthameba species, they can be encysted too, with a cyst wall surrounding it, and this is a good example of that. Image again taken from ExpertPath, and this is the shrinkage artifact which has made this pentagonal shape within the encysted form. And GMS stain, it can be used to highlight the cyst wall of Acanthameba species. It's a good stain for highlighting the organism. Now, what's the pathogenesis? How the disease occurs? So the route of invasion and penetration into the brain is hematogenous, means through the blood. Probably it's either a lower respiratory tract infection or a skin infection, and infection most commonly occur within the chronically debilitated, weak, immunosuppressed individuals. So it doesn't occur in healthy individuals. How it would present, like within the skin, it can involve the face, the palate, extremities, trunk, and it can be either a single lesion or a disseminated chronic plague-like ulcerated skin lesions, and they are mistaken for chronic fungal or mycobacterial infection, and it can progress to CNS disease. And when it's progressed to CNS disease, how it would look like, that's I've already shown you before, and that's the granulomatous amebic encephalitis, and it's an indolent progression initially over weeks to months. That's a slowly progressive disease, usually fatal with 90% mortality rate, and again it spreads through blood, through skin or nasal passages. And meningoencephalitis, when it's developed, then the host symptoms will be fever, headache, stiff neck, nausea, vomiting, lethargy, focal neurologic deficits, including all. So this is how the overall disease would present, and that's all for today. Thank you so much, everyone, for your attention and for your patience. I would thank my mentor, Dr. Daniel Child, who gave me the opportunity to present and with the whole slide archives, and my fellows, Dr. Alex, Dr. Joyce, and Dr. Lucy, Neuropath Fellows at GeoWash. And that's all for today. This is just a nice memory. It was a bird's eye viewpoint from our conference room at UWash. This is the whole view of Seattle scene. So we used to just relax and chill, staying here, seeing the whole view, calming ourselves down. This was the view of nice, their Great Peaks Mountain. So that's all.